welcome back to my channel. This is the third time that I'm trying to record this, so hopefully third time is a charm. So let's see. It's a Q&A, and you know, as a disclaimer, of course, I'm just a patient, and these are just my my experiences with it, nothing else. So, question number one. How were you diagnosed? I was diagnosed by a 3D mammogram, and after a few days, I received a letter that I had something suspicious on it to go back for a diagnostic mammogram, and that's when the radiologist came back and said that he showed me what it was. It was a bunch of calcifications, and he said that he was very suspicious and I should do a biopsy. So, did you feel a lump? Did you feel pain? No, I had no lump. Pain, I don't know if it was related, but looking back, I was having some like sharp shooting pains on that breast, so it might be related. So, how was the biopsy? The biopsy was just a drag. It was not too bad. It was a mammogram guided core biopsy, and so it's just uncomfortable, but it's nothing to be fearful of, and you are very well taken care of, so not a big deal. Did you receive your results in person or over the phone? Over the phone, because I was out of town and I was at my friend's house, my business partner's house in New Jersey, and that's where I received. The radiologist called me. He was a sweetheart. He was super nice. What happened after the diagnosis? I contacted my GP and scheduled an appointment with her, and then from there she referred me to my surgeon. How did you find your breast surgeon? Like I said, my GP. And your plastic surgeon? My breast surgeon worked usually with 4 or 5 different plastic surgeons, and I went through the process of elimination of the ones that I liked the most and the ones that accepted my insurance. And I came, you know, and that's how I chose mine. What additional tests were done after you were diagnosed? An ultrasound, a genetic test because of my family history, and an MRI. What options were given to you by your surgeon? My surgeon said that I should do a lumpectomy with 5 or 6 weeks of radiation. What type of surgery did you choose and why? I chose a double mastectomy because of family history and because I did not want to go through radiation and have an elevated risk of having cancer. Did they remove lymph nodes and how many? Yes, they did. 4 on the cancer side and 2 on the non-cancer side. Some people say that DCIS is pre-cancer and not cancer. Do you consider it that you were overtreated? This question pisses me off. DCIS is cancer. The only difference is that the cancer cells are contained into the milk duct. They have not yet get out of it and become invasive, but those are the same cancer cells that invasive carcinoma are made of. So yes. And no, I was absolutely no overtreated. You're gonna know why in a little bit. Were you advised of the risks of lymphedema, and what do you do to try to avoid it? I was told that was extremely rare, and I was honestly not told anything on how to avoid it. I did my own research on that, and it turns out that you can have lymphedema if you remove 1 lymph node. I removed 6. So yes, I do have a choice. Oh, a choice, not a chance. And what do? I wear lymphedema sleeves, compression sleeves when I travel. And even if I travel by car, like long distance, I do not have blood pressure, IVs, blood tests, or punctures, injections on the arm that were taken the most nodes. I try to have it on the other arm or on my foot and leg. So that's what I try to do it. How long did you wait between diagnosis and the surgery? 2.5 months. Did you have reconstruction, and if so, was it immediate? Yes, I had what it's called a DIEP flap reconstruction, which is mainly basically a transplant of your lower abdomen skin and skin, fat, and blood vessels into your chest cavity. Chest cavity? No, your chest, your breast. Your breasts are made of that tissue. It's called flap. So that's what I had. Um, how long was the surgery? 10.5 hours. It's a very long surgery. How long was the hospital stay, and did you stay in the ICU? I was approved to stay 5 days, I think, and I only stayed 2, and those 2 days were in the ICU. And the reason that you are on the ICU is because you need an extreme amount of care. Every hour, a nurse comes with a Doppler to check on your blood vessels to make sure that they are feeding, the flaps accordingly, and if not, you need to go into emergency surgery. But yes, so absolutely, I did stay on the ICU. Did you have someone stay with you in the hospital? Yes, my brother stayed with me during the entire time. Did you have, what did you take to the hospital? I took an extension cord, my phone charger, a back scratcher, which you use to pull things close to you, pajamas to come back home, and underwear, stuff like that, toothbrush, toothpaste, and flip-flops, and pillows to come back home, like to protect my breasts, and axilla pillow, which are little pillows for your axilla to give you comfort because of the node removal. So those are the things that I took. Not a lot of stuff. Did you need a special bra or compression garment? No, you cannot use anything. Well, according to my doctor, and every doctor is different. My doctor doesn't let you wear anything for 6 weeks. So I wore no bra for 6 weeks because that connection, that blood vessel connection, is so fragile that you need to protect it. You can't be moving or applying pressure because you can rupture it. So no. Did you need help when you got home, and for how long? Absolutely. Look, you can't carry weight, you can't get up, you can lay down, you can't cook, you can't, if you have pets that I have 7, you can't feed them. All you can do is rest. Your job after the surgery is to rest. So absolutely, I had 3 people at home. I had my brother, I had my cousin, and I had my friend Kelly. Kelly took care of me and my pets, and my brother and Leah took care of me. They flew. I live, as you can tell by my beautiful accent. I live in another country. I mean, I live in the US. My family is from Brazil, so they flew in from Brazil to take care of me, which I am forever grateful. But yes, you do need. For how long? I would say 2-3 weeks. I was fine after 2.5, 3 weeks. What medications were you sent home with, and how did your body react to them? Mainly just pain medication, which I chose the lowest one, like the weakest one, tramadol. Um, the only side effects that I had was really TMI, constipation. Trust me, you wanna blow up fireworks when you poop. it's it's a big problem. But aside from that, oh, nausea medication as well. For some reason, you have nausea for a little while, so yes, I did that, and nothing else. I didn't need to take antibiotics or anything like that. So, what could friends do to help you out with recovery? Visit, help with cleaning, help with transportation, but the main one, I think it's food. For weeks you leave out of takeout, and not even takeout, food delivery. Thank God for Uber Eats, because you can't cook, you can't go to the supermarket and buy food. So it's that would be very helpful. How long after the surgery were you able to take a shower? Did you need help? 2 days. Just when I got home from the hospital, I took a shower. No, I did not help. I did not need help. I had a little pocket to put my drains inside, and just took a regular shower. So, did you lose range of motion? And if so, did you need physical therapy? No. My range of motion is perfect from day one. Never lost it. So no physical therapy. Did you have drains, and how many? Yes, I had 4 drains, 2 from the breasts, 2 from the hips, and they were taken out when they were collecting less than 30 cc's of fluids a day. So yes. How did you receive your pathology results? Over the phone. My breast doctor called me. What were they? If you remember in the beginning, I said that my first diagnosis was DCIS. My pathology results, however, came back with DCIS and an invasive carcinoma hidden within the DCIS, that no test got it before. And also on the other breast, atypical hyperplasia, which is a precancer. So basically you go from atypical hyperplasia to DCIS to invasive carcinoma. So I had DCIS and invasive carcinoma and atypical hyperplasia. So I did the rightest thing to have a double mastectomy. And I was no longer stage 0, I was stage 1. How long is the recovery for a DIEP flap? It depends. This is a multi-level question. Like, you can drive within 3 weeks, probably, as long as you're not taking narcotics, pain medication. But you have full restrictions until you are at 6 weeks. So 6 weeks you are healed and you don't have your restrictions. However, your body took a big hit, so you feel much more things. You still feel fatigued. Like, I went back to Pilates at 6 weeks, and I kid you not, I would do the easiest class. And for 2 days, it would feel as though a truck hit me. So it's a weird question. There is no real answer, it depends on you. I had a pristine recovery, but still, my body still felt um, different for quite a while. Um, how long did it take for you to drive? Between 2.5 and 3 weeks. How was the pay level? Don't trust the people that say, oh, it doesn't hurt. It hurts like an MFer. It hurts a lot. But, you know, you have pain medication. For me, at the hospital, it hurt so much that morphine was nothing. It did nothing. So they added tramadol on the top of morphine, and then it started working. And also, you know, as much as it hurts that much, every day gets a little better. So it's not something that you can't deal with it. It's doable. It's doable. I keep hearing about phases. What are they and how many did you have so far? Well, phases are a slang basically on our DIEP flap community, which means the subsequent surgeries, like the tweaking surgeries. I've had 3 surgeries so far, and I will have a 4th, and you will know why. The first surgery, the goal of the first surgery is to transplant the tissue from your belly to your breast and keep it alive. So it's not shape, it's not perfect shape, it's none of that. And then the second surgery, you do the refining, the tweaking. For me, my areola was made smaller. Areola, it just meaning the scar that looks like an areola. I rebuilt a nipple, and I corrected my scars on the side of the hips, and I had a fat graft. And so that was surgery number 2. Surgery number 3 was a fat graft, and I added silicone implants because I was just not happy with the projection. How many surgeries are necessary? This is a completely individual question. Like, there are people that are one and done, like they're happy with one surgery and they stick a nipple tattoo and they're fine. And there are people that have many surgeries. I think I'm gonna be 4, and I'm gonna be completely done. Are the subsequent surgeries easier to recover? Meaning like phase 2, 3, 4? Absolutely. They're a walk in the park compared to DIEP. Although I will say that the implant one, the first night, it was excruciating, the pain. It was awful. But then it got better. I think I took pain medication for 1 night only. So, yeah. Did you need a recliner? I hear that you need to sleep on an angle with a wedge on your back. For how long do you need to do this? No, you don't need a recliner. I bought a recliner, which is this thing that I'm sitting on it, and it only serves me to do videos. It gave me a huge migraine when I used it. So I immediately moved, the next day I moved to my bed. A wedge, yes, you do need a wedge, because you don't want to put pressure, you don't want to stretch your abdominal incision, which is huge and not healed yet. And the wedge makes you sleep a little bit curved, so if your sutures here is not as pressured as if it was like that. So for how long? You know, I don't remember. It's I think the first surgery is for as long as you think it's necessary. Your body pretty much tells you, you know, when you start walking upright and straight, that's when I think you can sleep without the wedge. Um, I think I was able to sleep on my side after a few weeks, 3 weeks. So, after you put implants, for how long did you need to sleep on your back? At least 3 weeks, but I am at 5 weeks and I still do, because I want to do the very best for my breasts. One thing that made a huge difference was a full body pregnancy pillow. That was a game changer. So highly recommend it. Um, do the implants feel natural or do they feel hard and cold? Totally natural. I don't feel pain. I don't feel anything. They're not hard. They're really soft. They feel like part of my body. I don't feel them moving. They're not cold. They're perfect. Any tips to make sleeping more comfortable? Cold room, and yeah, the pillow that I said, the full body pillow, that's a big one. Were you left with any side effects from your surgery? Yes, I was left with a pretty big hernia on my abdomen, which is the reason for surgery number 4. Did you have any complications? None whatsoever from any of my surgeries. My healing was perfect. If you could give advice for people going through this surgery, what would you say? Mentally, get ready that you will never be the person that you were before. Don't expect your body to look the same. Don't expect it's completely different. You are a different person. And you can be happy, you can be sad, you can be distraught, but you will have huge scars. Your breasts will have no feelings. Most of the time, that's what happens. I don't. You will not have nipples for a long time. So, yeah, yeah. The other thing that I would say is work your legs. Work your legs, because your legs are your independence. The more you work your leg, you can't use any muscles, your arms, you can't use your core, so all you can use your legs. That's to get up, to get down, to go to bed, to get on the floor, to go to the bathroom. Everything is on your legs, so work the heck out of your legs. And eat lots of protein, healthy protein. um you know, protein is the building block for tissue regeneration, and if you don't have it enough, you are going to have issues. Were you left with a lot of scars? Do you use anything to minimize them? Yes, I was left with a lot of scars. On the breasts, after I put implants, I do tape my scars, just because the implants stretch the skin and I don't want the scars to be stretched, and that tape is micropore. On my abdomen, I will just revise that scar and make it thinner, because there's no way to make it really, fine. It's too much pressure on the tissue. When you take so much tissue and you sew your back in, there is the whole pressure, and it's just the nature of it. How did the process meet your expectations? I had the expectation of being cancer-free, and I am, so 100%. How are your feelings about your mastectomy and your new body? Love my body, have a whole new respect for it, how strong it is, how resilient it is. And yes, I'm still doing surgeries. Yes, I can still be better, but I love my body. And mastectomy is a little bit different because you have no feelings on your breast, so you know what's having feelings on your nipples and your breast, and you don't have it. So that's a different thing that your mind needs to get used to it. Did you need chemo and radiation, and why? No, I did not. I had no nodes involvement, thank goodness, so no radiation. Are you in any sort of treatment? Yes, I am on tamoxifen. What are the side effects of tamoxifen? I had headaches, I had insomnia, weight gain, joint pain, body aches, hot flashes, mood swings, depression, fluid retention, like my legs swelled a whole bunch. I mean, a lot of side effects. Yeah, tamoxifen is not an easy. You basically go on menopause like this, and so yeah, and oh yeah, and the, TMI, your libido just goes. But anyways, is there anything that you can do to control them? Absolutely. Your oncologist is your best friend to help you with side effects. For joint pains, I take Claritin. For all the other side effects, I take an antidepressant called FAQs, and it works like a charm. So I am good. I feel very little side effects. I do feel fatigue. You're usually tired. You're usually tired. So, how often do you see your oncologist, GP, breast surgeon, plastic surgeon? Oncologist started every 3 months, then now it's every 6 months. GP, I see her twice a year. Breast surgeon once a year. Plastic surgeon all the time because I've been in and out of surgery. Did you have any scares after your diagnosis? Yes, I did. I had a lump on my axilla area, and everybody thought that was a swollen lymph node, which it can be very scary. So I did an ultrasound, and then a month later I did another ultrasound. It turns out to be just a reaction to the surgery. It was not malignant. And then a few months ago, I had a CT scan to look for a hernia, and by accident they found a nodule on my lungs, and then I had to have another CT scan 3 months later to see if that was benign or malignant, and it was benign. It's just apparently it's just something that it's caused. It's a little small lung collapses that happens because of surgeries, and since I had multiple surgeries and a very long one, that totally makes sense. Do you consider yourself cured? No, I do not believe in a cure for cancer. I do believe that we have, once we are diagnosed with cancer, especially invasive cancer, there is very little chance that a cell didn't escape through your blood or your lymphatic system, and it's in there just waiting to boom. And so yeah, it might be, a cynic way of seeing it, but that's how I see it. What did you do? What did you change in your life routine to try to remain cancer free? Stress. That's the big one. I don't stress as much anymore. I don't give a darn about a lot of things that I did before. So, do you take any supplements? I did take a whole lot of supplements in the beginning of this journey. Now I don't. I take just a few things to help me with my immune system, which is zinc, vitamin C, vitamin D, and yeah, that's pretty much it. How has your life changed? I am always in and out of doctors. I appreciate life much more. I don't stress as much. I have more plans to the future. I try to live more. Yeah, changed to the better, I think. Silver linings. Are you in pain? After surgeries, obviously I am. Right now, no, not really. Not really. Do you feel fatigued? Yes, I do. It's hard to get up, and it's hard to stay awake. So yes, definitely. Did you have any issues with insurance? No, my insurance has been great. What about financially? Yes, I am deeply in debt. You know, those deductibles and out of pockets are pretty intense. And so yes, I am in debt big time, but you know, nothing that I can't manage. How did your diagnosis affect your work? Thankfully, thank goodness, I have my own business. I co-own a business with a wonderful person, and which gives me the flexibility to be treated, heal, take time off, so on and so forth. And the money doesn't stop coming, so it didn't really affect my work. Are you paranoid or in fear about the cancer returning? You always have that fear. You always have that fear. Am I paranoid? No, no. Do you think it will return? Yeah, probably. I just hope that it doesn't return, that I catch soon enough. But it's you know, it's, yeah, I'm pretty young and I have a long life ahead of me. So it's a good possibility that it will. Why do you make these videos? To help people. These videos helped me tremendously when I started my my journey, and if I can help one person, one single person, it's all worth it. So I'm just passing forward what was given to me. If you could change anything in this process, what would you? Obviously, I wouldn't have had cancer. That's an easy one. What message would you give to friends and loved ones of cancer patients? What would you like them to understand? Understand that cancer never goes away. It's not because I had surgery that I am cancer free. It's actually here in the US, they prefer to not even use that. They just use NED, which means no evidence of disease, which means that for now you have no disease. Understand that it's not, when we have the fear, the worry, and when we have some pain and we want to go to the doctor to get checked out and we're worried about things and so on, we're not being dramatic. Don't say that we're being dramatic and that we need to get over and that's done, because it's never done. This is not drama, it's reality. Cancer is never gone. Once you have it, you have it. And if you don't have an active disease, you have that on your mind. Sure, you don't stop living your life, but that's part of your life. You live with it. You learn how to live with it. And try to help. You know, don't ask them what you need for help. Just do it. Just help, because we need help. We need help. All right. So that's all. This video is being extremely long. It's the third time that I recorded it. I hope it helps somebody. I'm sure that there are other questions that I didn't answer, but what is it? 35 minutes already. So anyways, if you have any other questions, feel free to leave me a message below on the comments. And if you like my videos, click subscribe. Thank you so much, y'all. I will see you later. Bye.